Hey everyone, Dr. Charlie Johnson, physical therapist, and today I want to cover the 3 most common causes of TMJ. TMJ is just another way to say jaw pain. The fancy way that us medical professionals kind of spell out TMJ is really TMJ means the temporomandibular joint. So the TMJ is an actual joint, okay, and it's just basically the joint that's formed between where the jawbone meets the skull, and it's located right in front of the ears. So if you're watching this, you likely have pain, usually just on one side, and it might be located kind of at the connection between your jawbone and your skull at the TMJ, at the joint right in front of the ears. So some other things you might have include ringing in the ears, kind of stuffiness in the ear. You might have jaw pain that has affected your ability to eat, to talk, and anything else that might involve just kind of moving your mouth. So with that being said, the 3 common causes is what we're going to cover today. We're going to walk one by one through them right now. So first things first. So cause number 1 is muscle. So this is the majority of people who come in and they have jaw pain is actually caused by pain that is created by tension, tightness, or kind of overuse of the muscles surrounding the TMJ or the jaw joint. So an easy way to kind of tell if the muscle is causing your problem, the first thing would be is to actually take the pads of your fingers and kind of run it down the side, starting at the joint and moving downwards, kind of along your jaw line, and then up along the sides, kind of around your temples. And you really are just asking yourself, does it feel more sore on the side where my jaw hurts versus the other side? So first things first is that if a muscle is causing your jaw pain, again, which is the most common cause of TMJ, then you're just going to have sore muscles. So sore muscles is number 1. Okay, the second thing that we're going to see if muscles are causing your problem is that you will often have actually no problem opening your mouth. So you'll have full range of motion. You'll have full motion with regards to opening your mouth. And actually, just a quick tip, what we consider to be normal opening for the mouth would actually be your ability, if you could actually fit three fingers or 3 knuckles actually just on the inside of your mouth when you open it as wide as you can. So usually people who have muscle problems not only have sore muscles, but they have full motion. And the next thing, so I'll write that down. Okay, so great. So you have sore muscles, but you have full motion. Now, this motion would be considered abnormal because you can't just open your jaw straight like you would, I guess, before you had jaw pain. You'll often notice if you look in the mirror that the jaw, when you open it, kind of feels uncoordinated, like it just doesn't move quite right, and it'll actually kind of form like an S shape. So it'll kind of curve and kind of wiggle as you open. So there's like an S-shaped curve. When you open your mouth. The final thing is if you have a muscle problem that's causing your jaw pain, you should have no clicking, no noises, no sounds, no nothing whenever you try to open your mouth. So final thing, no clicking or no noises. Okay, great. So the first cause, most common cause of jaw pain is pain that comes from the muscles surrounding the jaw joint. The second most common cause that we see is actually pain coming from the joint, the temporomandibular joint itself. So within the TMJ, there's actually a little disc, okay, that's controlled by some nerves, and it can actually cause pain. So now, based off how some muscles connect to this disc can kind of be pulled around some different ways, and just become a little bit displaced, which can cause different pain when you try to open your mouth or close your mouth. The hallmark sign of a joint problem causing your jaw pain would be that you have noises. So you have clicking, popping, you may feel some locking in the jaw, or an inability to open the mouth as far. It just won't quite go as far as it used to. But really, you're going to hear some noises, okay? So again, a muscle problem that's causing your jaw pain traditionally has no noises. Full motion, uncoordinated, but no noises at all. A joint problem is noisy. Again, clicking, popping, locking, things like that, maybe a grinding sound. So that points to more of a joint problem than a muscle problem. The other thing that we'll see is that not only will you often have, you won't have full range of motion oftentimes, and if you do, you'll have the noises. But when you open it, what you'll see is that it won't just be in coordination. It won't just kind of go all over the place. You'll actually see that when you open your mouth, say I have a problem on my left side, you'll actually see that the jaw kind of goes in a C shape towards the side that's bothering you. So it would kind of look something like this. If my left side was bothering me, as I would open, you would kind of see that the jaw hooks to that side of whatever side the pain is on. So we'll say like a C shape. When you open, and I think I said motion limited. So again, it's a little bit tougher to open. You have some noises. It may feel like it's locked up a little bit. You're not able to get those 3 fingers or those 3 knuckles in the mouth anymore. Might be limiting your ability to eat just because it won't open far enough. And you have a C shape where that jaw actually may hook to the side of your pain. Okay? So I'm going to erase one, so actually you should be able to see it. So the third common cause of jaw pain is actually from the neck. So this is one of the most overlooked problems that I see with patients who come into my clinic with jaw pain, is that you know, the neck is contributing. Now, how do we know if the neck is contributing to your jaw pain? The big key indicator here is that you may have not only jaw pain, but you also have jaw pain and headaches. Okay, so. And hopefully it's not off the screen, but if you have jaw pain and you have headaches, let me talk about what kind of headaches. I'm already starting to think that the neck is a problem that may be actually contributing to your jaw pain. What's really neat is that the upper 3 joints in the neck, where the upper 3 bones meet in the neck, kind of that area where they join, is actually connected into some of these signals that send information to the jaw and different parts of the head. Pretty cool, right? So actually, just by treating the joints in the upper neck, we can actually change things like ringing in the ears, as well as some pain in the head and headaches, as well as jaw pain. So headaches, but there's something special about these types of headaches. These headaches can be on both sides, almost like a band around the forehead, but often they start in the back of the neck. So that's criteria number 1. You have headaches that start in the back of the neck, or you have headaches that start, and you have headaches that start in the back of the neck and it radiates forward, almost like kind of like they describe it as like a ram's head, so, or a ram's horn. It kind of wraps from the back all the way around the side, maybe even going to the eye and or to the temple. Okay, so a test to determine if the neck is an issue is, number 1, just ask yourself, does your neck feel stiff, and is it sore, and does it not move as well? Okay. If you actually want to see if it doesn't move as well, there's a way that you can isolate the joints in the upper neck and see if they aren't moving as well as they should. So you're just comparing one side to the other. The simple test is, I want you to bend your chin as far as you can towards your chest, and you're going to try, as you keep it in that position, to turn your head to the right and to the left, and you're going to see if there's a difference and or pain, stiffness, or problems going one way versus the other. So really easy. It would look something like this: chin to the chest, and then you're going to turn right or left. So just like this. Now my motion feels like maybe it goes a little bit more to the left than it does to the right. But if you have a problem with the joints in the upper neck that could be contributing to your jaw pain, you will see oftentimes that it just won't go as far, and it will cause pain or maybe even reproduce your headache in some instances. So hopefully you can see this. Again, sore muscles, often full motion, but you have some incoordination, no clicking, no problems there. If it's a joint issue, you will often have clicking, popping, locking. You won't be able to open the mouth as far, and you will have a deviation or kind of a hooking of the jaw to the side of the pain. So if the left side, again, the jaw as you open will hook to that left side. And then the neck. So again, headaches, neck pain, and decreased motion. Also, starts in the back and kind of wraps around to the front of the head. So with that being said, these are the three most common kind of contributors or causes of jaw pain. What I want you to do actually is if you're reading these and you notice that some things kind of sound familiar, remember there's a catch to this because you can have multiple things that are occurring at one time. But that's kind of for me to decide, or any of your other healthcare providers that you're seeing for your jaw pain. But really, if you're reading this and one of these really pops out as to something you think could be causing your problems, I want you to take a look at these, try to decide what you think, whether it be muscle, joint, or a problem with the neck, or maybe just a combination of the three that could be causing your problem, and actually send me an email. If you can, I'll personally respond to you. And my email is charliejohnsondpt@gmail.com. I'll erase this. I'll write it right at the top here for you. And, I'd love to respond to you and help you out and try to figure out how we can, better relieve your jaw pain. So hopefully this is helpful. I'll write my email here. So there you have it. Thanks so much, everyone.